Hello. Welcome once again to this channel. Today I'll be taking through fully funded PhD in public health. I have about 30 schools I'll be taking through. So take your time and then go through the schools one by one so that you wouldn't miss any opportunity. But before that, please subscribe to this channel if you haven't done that. And then if you're a returning subscriber, thanks for visiting this page once again. The first one we are taking a look at is Drexel University, Donsiff School of Public Health. This is the school's page, PhD in Community Health and then Prevention. Let's look at the funding they have for us. It says 95% of PhD students receive tuition remission, stipend, and health insurance. In general, PhD students finance their education through a variety of sources, and the Donsiff School of Public Health provides financial support through training grants, scholarships, stipends, and working as a teaching or research assistant. So they are often fully funded opportunity for their PhD students in community health and prevention. That is the Donsiff School of Public Health of Drexel University. The second one we are taking a look at is the University of Tennessee's Department of Public Health. This is the school's page. Let's look at the funding they have for us. That is the Department of Public Health. Let's look at the funding they have for us. Okay. So they are often graduate teaching assistantships. When we say graduate teaching assistantships, you are going to teach first degree students and then master's degree students, and then in turn they will waive your tuition fee for you and then give you a monthly stipend. So that's it. So let's look at the benefit one is entitled to get. It says all positions provide the following: tuition or maintenance fee, health insurance, monthly stipend paid over 12 months. That is it. So you work for the school and then in turn they waive your tuition fee for you, give you health insurance, and then give you a monthly stipend. That is the University of Tennessee's Department of Public Health. The next one we are taking a look at is the University of Connecticut Department of Health. That is the Graduate School of Health. Let's look at the funding they have for us. It says they are also offering need-based aid and then graduate assistantship positions. The current full-time graduate assistant for students supported through the Yukon Health is $34,000 per year. So you're entitled to this $34,000 per year if you are working as a graduate assistant. It is either you teach or you help the faculty in conducting research, and then in turn they will waive your tuition fee for you, give you a monthly stipend, and give you health insurance coverage. That is University of Connecticut's Graduate School of Health. The next one we are taking a look at is Yale School of Public Health. This is the school's page. Let's look at the funding they also have for us. It says all PhD students are guaranteed 5 years of 12 months stipend and tuition support in the form of Yale School of Public Health fellowships, teaching fellowships, traineeships, and research assistantships. In addition to support for tuition and living costs, students receive a health award to cover the full cost of single-suite Yale health plan hospitalization. So you can see they are given full funding, guaranteed 5 years of full funding with monthly stipend. They waive your tuition fee for you, they give you monthly stipend, and then give you health insurance coverage. That is the Yale School of Public Health. The next one we are taking a look at is the Oregon State University. This is the school's page. Let's look at the funding they also have for us. Okay, so Oregon State University, College of Health and Public Health. So let's look at the funding they also have for us. Let me scroll down. It says most of our public health doctoral students are funded through teaching or graduate research assistantships, which includes tuition remission and a stipend. Others are funded through scholarships and then fellowships. So you can see they are also offering both graduate and then teaching assistantships. And then in turn, you'll be given a tuition fee waiver and a monthly stipend. They have other scholarships too and then other fellowships. So that is Oregon State University Department of Public Health. The next one we are taking a look at is Texas A&M Department of Public Health. Let's get the funding. So this is the school's page. They are also offering graduate assistantships and then other funding opportunities. So let's look at what we have. It says graduate assistantship, that's teaching, and then have research assistantships. So you teach the undergrads and then master's students, or you help the faculty in conducting research, and then in turn they will give you a monthly stipend. In addition, they have extra scholarships that one is entitled to get. So that is what they are also offering their students. The next one we are taking a look at is the University of York Department of Health Sciences. Let's look at what they also have for us. They say we offer a number of fully funded and self-funded projects open to prospective research students. So they are offering full funding, and then those who want to self-fund themselves too, they can also self-fund themselves for their PhD in Health Sciences program. So that is the University of York Department of Health Sciences. The next one we are taking a look at is the University of Waterloo in Canada. That is the PhD in Public Health Sciences. Let's look at the funding they also have for us. It says the Faculty of Health is committed to providing guaranteed funding over 4 years to support new domestic doctoral students as part of its PhD funding initiatives. Students may also be eligible for additional scholarships and then funding opportunities. That's it. So they're also offering full funding, 4 years of funding for their doctoral students in public health science. The next one we are taking a look at is Washington School of Public Health. Let's look at the funding. They also have several funding opportunities. So these are the funding that they have. They have endowed fellowships and different graduate awards. So that's it. They have several of them that one is entitled to get. So you can go to the university page and then go through the awards one by one. This one is School of Public Health Office of the Dean Master's Fellowships. This one is for master's students. They have several of them for their PhD in public health. That is Washington University School of Public Health. The next one we are taking a look at is the University of Toronto Department of Public Health Science. Let's look at the funding. They also having offering funding for their PhD and then master's students. So if you have interest in this school too, you can apply to this school. It's a very nice school, University of Toronto in Canada. The next one we are taking a look at is the University of Minnesota School of Public Health. They are also offering several scholarships. So they have fellowships and then traineeships. The fellowship, you don't need to work. You are given funding. You don't need to work. For the graduate assistantships, you work. And then in turn, they waive your tuition fee for you. So that's it. That's the difference between fellowship and then graduate assistantship. Graduate assistantships, you work. Either you teach or you help the faculty in conducting research. And then in turn, they waive your tuition fee for you. For the fellowship, they are just giving you funding for you to conduct a particular research. That's it. That's the fellowship. So let's look at the graduate assistantship positions. So they are offering graduate assistantships for their PhD students. And then in turn, they give tuition benefits, health insurance, and then other appointment that one is eligible. So that's the graduate assistantship position for their students. That is the University of Minnesota School of Public Health. The next one we are taking a look at is Michigan School of Public Health. That's the University of Michigan School of Public Health. Let's look at the funding they also have for their students. It says funding and financial aid. It says many doctoral students at Michigan Public Health are fully funded. All students admitted to one of our doctoral programs are considered for financial funding. So that is the University of Michigan School of Public Health. The next one we are taking a look at is the University of Chicago Department of Public Health Sciences. So this is the school's page. Let's look at the funding they also have for us. It says we are one of a small number of related programs that guarantee full funding for the PhD program. So you can see from the university's own page, they are offering full funding for their PhD in Public Health Science. That is the University of Chicago Department of Public Health Science. The next one we are taking a look at is the University of British Columbia in Canada. So this is the school's page. They are also offering funding for their PhD students. It says applicants to the University of British Columbia have access to a variety of funding options, including merit-based and then need-based. So they have funding for their PhD students, and then they have extra scholarships and then awards for their students. And then in addition, they have graduate teaching assistantships and then research assistantships for their PhD students who are admitted into their public health department. That is the University of British Columbia in Canada. The next one we are taking a look at is Temple University. So this is their school's page, Health Policy and Health Services Research degree. That is the PhD degree. So they are also offering funding for their PhD students. Let's look at something here. It says funding for doctoral students. The College of Public Health offers all PhD students a competitive level of support, including tuition, stipend, and health insurance for 4 years. Their assistantships sponsored by the College of Public Health are outlined below. So they have research assistantships and then grad assistantships. It means you work and the intern, they will waive your teaching fee for you. So you work as a teaching assistant or as a research assistant, and the intern, they will waive your tuition fee for you. So that is the University of Temple. So Temple University Department of Health. The next one we are taking a look at is the University of Alabama at Birmingham School of Public Health. Let's look at funding. They also have for us. It says fellows receive a monthly stipend, tuition, and health insurance benefits. So that is it. So that is one of their fellowships program. So the Healthy and Active Lifestyle Energetic Graduate Fellowship. So that is the benefit one is entitled to get from this fellowship. So they are also offering funding. So if you are admitted into this PhD program, you receive a monthly stipend, a tuition fee waiver, and then also health insurance coverage. That is the University of Alabama School of Public Health. The next one we are taking a look at is Fraser University Faculty of Health Sciences. Let's look at the funding they also have for it. This is the school's page. Let's look at the funding. It says all PhD students in the Faculty of Health Sciences receive financial support either from scholarships, teaching appointments, or professors' research grants. The minimum PhD stipend is $28,000 per year for 4 years. So that's it. So they are providing you with funding, full funding for 4 years. They will waive your teaching fee for you and give a monthly stipend, and then health insurance coverage. So that is Fraser University Faculty of Health Sciences. The next one we are taking a look at is Stanford University Department of Epidemiology and then Population Health. Let's look at the funding they also have for. So they also offering student assistantships or graduate assistantships for their PhD students. So when you are admitted into their PhD in epidemiology and clinical research, you are given funding, full funding for that program. So let's read something. It says the department has limited funding available for their Master of Science and then PhD students, which is awarded at the time of admission by the graduate coordinator. The moment you are admitted into that program, they will state it in your admission letter that you are being given that funding. So that is Stanford University Department of Epidemiology and then Population Health Science. The next one we are taking a look at is Penn State University College of Health and then Human Development. Let's look at the funding. See, students entering the health policy doctoral programs are funded through graduate assistantships. Our assistantships provide roughly $22,000 per year in support, along with tuition waiver and access to health insurance. So you are given full 4 years of funding for your doctoral degree in health policy program. So you are given a tuition fee waiver, a monthly stipend for the whole year, and then health insurance coverage. So that's Penn State College of Health and Human Development. The next one we are taking a look at is New York University School of Global Public Health. So this is the school's page. Let's look at the funding they also have for us. It says students who are admitted into the program will be fully funded by a fellowship or a combination of research assistantships for 5 years. So the moment you are admitted into this program, you are either given a fellowship. A fellowship means you don't work. You are just fully funded, and then you study and then conduct research. But for the teaching assistantship, for research assistantships, you help their faculty in conducting research and also in teaching. And then in turn, they'll give you a tuition fee waiver, a monthly stipend, and health insurance coverage. The next one we are taking a look at is Georgia State University. This is the school's page. Let's look at the funding. They have several funding for their students. So that's the School of Public Health. Let's look at the funding. So they have graduate assistantships, and then fellowships and scholarships. So it's either you help the faculty in conducting research, or conduct the research yourself, and then in turn they give you tuition fee waiver, or you are given scholarships and fellowships. That one you don't need to do any work, and then in turn they'll pay for everything. They'll fully fund you. So that's it. And they have extra or other source of assistantship positions. In addition, the school have several other scholarships. So you can see they are here. They have several endowed scholarships, and then scholarships given by some families for those who are admitted into their PhD in public health. That is Georgia State University College of Public Health. The next one we are taking a look at is Harvard School of Public Health. Let's look at the funding they have for their students. It says all students, including international students, receive a multi-year funding package which includes full tuition fees, health insurance, and a stipend that includes teaching, fellowships, and research assistantships. So that's it. So Harvard is also providing full funding for their PhD in public health science. The next one we are taking a look at is Columbia University School of Public Health. Let's look at the funding. So this is the school's page. Let's look at the funding they also have for their students. It says scholarships, fellowships, and grants are awarded based on need or merit. So they are having several scholarships and fellowships for their PhD in public health science. So that is the Columbia University School of Public Health. The next one we are taking a look at is Brown University School of Public Health. Let's look at the funding they also have for us. So they are offering marry of funding opportunities for their PhD students. Let's read something from it. It says admitted doctoral students receive up to 5 years of guaranteed financial support. We encourage PhD students to maximize funding sources. So they have several funding here. So 5 years guaranteed funding. And then they have extra fellowships available for their students. This is the diversity fellowships. And then they have extra external fellowship programs that one can apply to. That is Brown University School of Public Health. The next one we are taking a look at is Indiana University School of Public Health. This is the school's page. So they are also offering funding for their students. So they have students who have been given graduate assistantships and then research assistantship position, and then they waive your tuition fee for you. So you can see associate instructor, graduate assistant, and then research assistant for their students. You work for them, and then in turn they waive your tuition fee for you, give a monthly stipend, and also health insurance coverage. So that is Indiana University School of Public Health. The next one we are taking a look at is University of Pittsburgh. This is the School of Public Health Epidemiology. Let's look at the funding they have for their students. It says Pitt's public health students may receive some type of financial aid in the form of student loans, full or partial scholarships, fellowships, student hourly jobs, or assistantships. So they have myriad of funding for their PhD in public health epidemiology. So you can check this school. It's a nice school. That is the University of Pittsburgh School of Public Health. The next one we are taking a look at the Purdue University College of Health and Human Sciences. So they are also offering funding for their PhD students. So this is the school's page. They have funding for their PhD students. So if you have interest in this school too, you can apply to this school for their PhD or Masters in Public Health. The next one we are taking a look at is McGill University Global Health Programs, or the Department of Global Health and Public Health. They are also offering funding for their PhD and then Master students. So if you have interest in this school, it's in Canada. If you have interest in this school, you can apply to this school. So you can see funding here, and they have extra support for travel and then conferences. So you can go to the university page, and then if you have interest in this school, it is McGill University in Canada. You can apply to this school. The next one we are taking a look at is the Johns Hopkins Bloomberg School of Public Health. This is the school's page. Let's look at the funding. They also have for us. Okay. So they also offering so many scholarships for their masters and then PhD students. It says all of the material that is submitted with your online application are important for the scholarship review process. So the moment you apply, they review all your documents for their scholarships. It says as you are applying for admission to the PhD program, keep in mind that your application will also serve as a scholarship application. So the moment you are applying to their PhD program, make sure you include that you want to be considered for scholarship or funding, and that application will also serve as scholarship application. So that is the Johns Hopkins Bloomberg School of Public Health. So these are the 30 schools that are offering full funding for their PhD in public health. Please subscribe to this channel, share, like, comment so that others too can benefit from this video. Thank you.